Hi, I'm Abeyna Jones, the Medical Director of Medic Footprints, and we've just had the first networking event of the year, which is From Medicine to Online Entrepreneur. And today we are really fortunate to have Dr. Louisa Draper, who is the Medical Director of Dr. Ed. So thank you very much for coming, Louisa.
Oh, thanks for having me.
No problem. So just to tease out some of the topics that were discussed today, can you tell me actually a little bit about what your role in Dr. Ed is at the moment?
So, as you said, I'm the medical director. So, part of my job is doing consultations with patients, and part of my job, probably the bigger part of my job, is overseeing everything that goes on in the company, whether it's marketing, IT, everything has a little bit of a medical input, so that's my responsibility.
Fantastic. So, you came from a clinical background, like most of the doctors. What was the career transition like?
I think what we've heard this evening, I probably went through the same thing that everyone else goes through, so it can be quite emotional. There can be some guilt about leaving the NHS or leaving the thing that you feel you trained to do. A lot of worry about uncertainties for the future, and I think I went through all of that. But at Dr. Ed, we've got a really great environment for doctors who are making that change. Everyone's been really supportive, and actually, probably happier now than I've been before. So, yeah.
What are some of the non-clinical skills that you've gained since in your role at the moment?
So again, we talked a lot this evening about learning to be really confident in yourself, learning to sell yourself. I guess I've learned to be really enthusiastic in learning new things and be really confident that I have the capacity to do that. So I used to think I only had my clinical hands-on skills, but I've learned a lot to do with problem solving. I've learned a lot about business. I've learned to think a bit more commercially. And actually in the environment we're in, we can make a lot of rapid changes to whatever the patient wants. So I'm learning to really listen to the patients and put that back into our business and make it a bit better for all of our customers and patients.
So one of the things we discussed was about self-value. As doctors, we are prone to sabotaging ourselves. What does that look like to you from when you look back at your clinical career and how you see yourself now?
So, as I said before, I think I worried a lot about leaving the NHS because I saw that was the end of my career as a doctor. I now realise doctors can do lots of different things, whether that means, actually we're lucky enough in our job that we always have that title doctor, so actually even if you go on to be something completely different, you are always still a doctor. For me, I have kept doing something a bit clinical, so I still very much feel like I am a doctor, and I still have a chance to use all of my clinical skills.
Awesome. So finally, what advice would you give to doctors who are in career transition at the moment?
So be brave and be bold, follow your dreams. I know that's easier said than done. I talked a little bit this evening about maybe trying to go part-time so that you can devote a bit of time to following your passions. And being really confident to take the leap, and the most important thing is to not listen to everyone else. People can put a lot of fear and doubt in your mind. Just be really strong in the power of your convictions.
All right, thank you so much for sharing your story, and that's me, Dr. Abeyna Jones from Medic Footprints, and please join our next networking event with Dr. Fi on April the 12th, and that will be in their offices. Take care.